Can you guys hear me now?
Yeah.
Yeah.
Sorry about that. This is my first time Zoom calling, so forgive me if that took a second. But how is everyone?
Good. How are you?
Good. My name is Rasha, and as you guys know, I am a nurse. I just want to get a quick, brief introduction from all of you. Just give me your name and what you possibly want to be going into once you go into college.
Yeah. All right. I'll start, I guess, and then we'll kind of like popcorn it around. So,
Perfect.
my name is Mohammed Hussein, and what I want to be when I grow up is a cardiac surgeon, with the
Nice.
heart and everything. So, uh, is that all? Just what you want to be, right?
Yeah, we can make it short and simple.
All right. Ava, you can go next.
My name is Ava Faraj, and I want to be a cardiothoracic surgeon. Batul.
My name is Batul Hamka, and I want to be an ophthalmologist. Sarah.
My name is Sarah Mugni, and I want to be a psychiatrist. Malak.
My name is Malak, and I'm not really sure what I want to go into, but I'm kind of leaning towards a PA.
You got to call
My
someone
name
else.
is Sajid. I want to be a cardiothoracic surgeon.
My name is Ahmed. I want to be an orthodontist.
My name is Brenna. I would also like to be an orthodontist.
My name is Hassan Al-Harakat, and I don't know what I want to be yet.
I'm Ali Yassine. I want to be a maxillofacial surgeon.
My name is Ali Shaheen, and I want to be a pharmacist or a pediatrician. I don't know which one yet.
My name is Amani.
My name's Amani, and I'm still undecided. Sorry for interrupting you.
No,
you're fine.
My name is Fatima, and I want to be an obstetrician.
My name is Liana, and I want to be a surgeon.
My name is Amal, and I'm an aspiring surgeon.
Who else hasn't gone?
Is that everyone?
Oh, my name
I
is
think-
Nora, and I want to be either a occupational therapist or psychiatrist, or yeah, I think that's it.
My name is Reem, and I want to be a PA or a CRNA.
My name's Aya, and I want to be a dermatologist.
My name is Adam, and I want to be a general surgeon.
My name is Mahan. I want to be a radiologist.
My name is Zahra, and I want to be a family medicine doctor.
My name is Reem, and I want to be a dermatologist. My name is Fatima, and I want to be a nurse practitioner.
My name is Zain, and I want to be an anesthesiologist.
Matt, did you have a question?
Yeah, I was gonna say my name is Mahdi Dabaja, and I either want to be a dermatologist or orthopedic surgeon. That's where I'm going.
All right.
Is that everyone?
I don't know because like the popcorn kind of got lost somewhere. So
No, it's okay. If anyone didn't introduce themselves, I'm sure throughout this session, I'll get to answer your guys' questions, and we can introduce ourselves from there. So I just want to say that you guys being a part of such a great group and taking an initiative at such a young age is a great start to all the careers that you guys have just named. It will look great on any resume that you put it on, or any position that you apply for, or even for college applying to schools. So that is a great start. And I do want to say that I guess we can start talking about nursing and what I do, and we'll go from there. So I guess we'll start with schooling wise. So for nursing, schooling required to be a registered nurse, you need to either hold an associate degree in nursing or just a bachelor in science in nursing in order to work as an RN. So the prerequisites required for it, the courses that you take, will depend on the program you choose, whether it's an associate's or bachelor's. So some entry-level courses include a lot of science courses, of course, such as anatomy, microbiology, chemistry, nutrition, psychology, and then and you can go beyond the level of just getting a bachelor's. You can go on to get your master's, and then that's when you would further your education, and you'll dive deeper into the subjects like emergency care, nursing research, and population-based practice. So for nursing like school, you'll need to have your high school diploma, but if you didn't graduate high school, you can get your GED in order to apply. And GPA wise, it varies from any school you apply, but you want to at least hold a 2.5 GPA, and then while other schools are more competitive, at least having a 3.0 or higher will be a benefit for you. So let's say once you find the program you want to go into, you do some research looking on their website and looking at their requirements. And usually some programs do require like an entry exam. It's just like a standard comprehension test sometimes that you take like a vocabulary test, so that has medical terms on it. It has like math portion, some science, but it's not that hard of an exam. So starting with me, the school I graduated from, I decided to get my associates in nursing before I went on to get my bachelor's. I went to Henry Ford College. So in my before applying to the nursing program there, I was at Madonna, and that's where I took majority of my prereqs. I was in between Henry Ford and Madonna. I was just taking classes at both colleges, and I did apply to Madonna's nursing program as well. And that Madonna's program is a bachelor's program in nursing versus Henry Ford College, that's an associate's. So I did get accepted into both nursing programs, but the reason why I ended up choosing Henry Ford was because the price difference. So I personally didn't want to take out any student loans. I kind of wanted to pay for college. So Madonna's program, one semester there was going to cost around $14,000 versus Henry Ford. The whole program, the 2 years that I was there, was going to cost $14,000. So I figured I'd go to Henry Ford's program, and then once I graduate, I can get a job at a hospital. And while I'm working full time, I can go back to school and do my bachelor's online. So I decided to take that route, and schooling took about 2 years. In total, it was 4 semesters. So I got to have my summers off, which was nice. Schooling wise for the nursing program was very, it was tough, but it's not something anyone can't do. It does require a lot of studying, and basic anatomy was the #1 course from your prereqs that really actually ties into nursing, and it really helps with it. So I always like to have flashcards on the go, and knowing my basic anatomy and med terms. But overall, I do say it is doable, and you just have to have that perseverance and drive to want to be a nurse. That goes with any school and wherever you apply, whether it's to be an MD or a physical therapist, respiratory therapist, anything you apply to, you have to have that drive in order to push you through studying and knowing that at the end of this, I'm going to be what I want to be and you're going to love it. So after nursing school, you graduate and then you have to take a state exam. That I was super nervous. So I always have the worst test anxiety. So I was super nervous for that, but the way the NCLEX works, they call it the NCLEX, is it's a test used to determine whether you're prepared for entry-level nursing, and the minimum amount of questions you get is 75 questions, or it can go up to 265 questions. So how it works is once you're taking the test, if you reach question 75 and you did pretty well in those 75 questions, then the test would end, and it would basically at that point deem you, you've answered the amount of questions you need to kind of test that you're going to be a good nurse. It doesn't mean if you fail the test that you're going to be a bad nurse, no, but it's a state board, it's required for to get your license. So, but if you didn't answer some questions right within the 75 questions, it can go up to 265 questions. So that's how that works. And then once you get your license, you can, with nursing, you can go through the endless opportunities. There's so many things you can do with nursing. A lot of people don't know that. A lot of people believe that nursing is just like bedside patient care, working in a hospital setting or like a clinic. But you could teach with a nursing license. Like some other places that you can work are in schools, churches, even government offices, community centers. You can even work with computers and with nursing, with a nursing degree. But the main ones are, like, of course, hospital, outpatient clinics, urgent cares. That's where nurses are needed most, especially in times like today amidst the pandemic. I can go on to explain what does a nurse do, and there's no typical answer to that, but like key responsibilities of a nurse entails performing physical exams. I'm going to speak on like hospital-based nurses. So what do? We perform physical exams and health histories before making decisions on patient care, and we provide health promotion, counseling, education, and interventions such as dressing wounds or incisions. So other things we do is we coordinate care in collaboration with other healthcare professionals. We work with a bunch of different type of help. I've worked with all the things you guys all want to go to. I've probably worked with and collaborated with a ton of healthcare professionals that you guys have named, such as physicians, respiratory therapists, pharmacists, physical and occupational therapists, for example, and there's just a bunch of other healthcare professionals. So that's on that, and then if some questions are like, what does it take to become a nurse? So it varies like on the skill set, but these are some of the top, like I would say 4 or 5 skill sets that you could either develop or have. And not to say that you need to have these just skill sets in order to become a nurse, but this would definitely help. And as you do become an RN, you kind of grow on these and you develop these skill sets. So some of them are communication skills. For nurses, being able to communicate is one of the most important skill sets to have. You frequently work directly with both patients and other medical professionals, which makes speaking and listening very critical, both in terms of understanding your patient needs and physicians' care plans, and and also speaking to patient family members and keeping them updated on the care you're providing to that patient. Another big important one is having empathy. So nurses should definitely be empathetic toward their patients and providing comfort and explaining complicated medical terms. when necessary. So the hospital experience is often difficult for these patients, and nurses serve the role as well as they're their care provider as well. Being detail oriented is a big one. So you should pay close attention to patient care because the smallest details can have far-reaching consequences when it comes to your patient's health. So being able to take in a large amount of information and act on it is one of the characteristics of being a nurse. Also, like knowing and when you come on your shift and getting the time to know your patient is important. And then also the last skill set I would have to say would be creative thinking and problem solving. So we frequently find ourselves in critical situations, especially in intensive care units or trauma care. Sometimes you have a very short time to make care decisions that can be life or death. So being able to think critically and make the right decision quickly is very important. So when I first graduated, like I said, I got my associates, and then I got my first job at Beaumont Dearborn here, not too far from home, in a regular medical surgical floor, which means the patient care that you have on a med surg floor is like your patients that have come in with pneumonia or COPD, or they come in with high blood sugar and they need to get that treated. Just very simple things like that. And typically on a med surg floor, you would have like on average 5 to 6 patients. So you would come onto your shift, I'd introduce myself and perform a head to toe assessment on my patient. And then I pass like my medications, and that's where you as a nurse, you start to become more task oriented sometimes and do the things that you have to do throughout your shift. So I did that for about a year and a half. And then I realized that I love when the adrenaline I used to get when something critical would happen to one of my patients. I loved being in that critical setting where you have to think fast and on the spot. And that's when I realized that med surg wasn't going to be my end goal. I did want to go on and get a job in the ICU, which is the intensive care unit. So that step for me to take was very scary, because when you think of intensive care unit, you just think of pumps, like machines going off, very, very critical patients that are on life support. So I was very intimidated, but I took that leap, and I got that job over a year and a half ago, and I love it so much. So I can go into do you guys have any questions at this point before I go into what ICU nursing entails of? Okay, so ICU nursing, it is a unit that's reserved for some of the most vulnerable patients in a healthcare system. It has patients that are very critically ill and need close supervision in case their condition rapidly takes a turn for the worse. So one major difference in this unit for nurses is the nurse to patient ratio. So like I had mentioned previously, on the floor I previously worked on, I would get 5 to 6 patients on each shift. But in the ICU, you typically only have 1 to 2 patients because of how critical it can be. So as an ICU nurse, you need to check in on the patient much more often due to the level of care required and the seriousness of their conditions. So like other nurses, ICU nurses monitor patients, administer medications, and we assist the patients with their basic needs, chart care, and respond to emergencies. Unlike some other nurses, the patients are often intubated in the ICU, which means they have a breathing tube down their throat and they're on a ventilator. So you're providing just life support because they can't contain their airway, and they have to have that breathing tube. and they also have multiple IV drips at a time. And you basically must know the ins and outs of a lot more equipment. So also with the ICU, the charting on a single patient is a lot more to keep up with for the intensive monitoring, your assessment and equipment. And you have to keep information accurate so that when a patient goes like unresponsive, you kind of know what could have possibly led to what. Not to say that you do know why a patient could deteriorate so quickly, but majority of the times that once you really know your patient and their history, you kind of can report that to the doctors when you're rounding with them. So some of the conditions that we see in the ICU or treat in the ICU are post-operative patients. So that means when they come out of surgery, it's typically the most common kind of patient in the ICU. Patients who have just received open heart surgery or had an organ transplant. Those are the types of patients that need close monitoring during their recovery. And another types of patients that we get a lot in our ICU is trauma patients, which they may be transferred from the ER after a car accident, assault, or getting gunshot wounds. So they may have multiple complications, including traumatic brain injuries or being in shock after those traumas. Other types is infectious patients. So dangerous infections such as sepsis can cause a variety of life-threatening complications and require an extremely sanitary and closely monitored environment to recover. Get some stroke patients in addition to post-operative care. Stroke patients will need diagnostic imaging and some physical therapy. And then we get some cancer patients who need to be admitted for recovery after intensive chemo or an unexpected infection or transplant surgery. And then we also get ruptured brain aneurysms, and controlling a patient's blood pressure may sound like a simple task, but in a case like this, even the smallest fluctuation could cause more bleeding in a patient with a ruptured brain aneurysm. But those are the types of things that you typically see in the ICU. And you can get a job into the ICU right out of nursing school, but it is harder. Some ICUs require to work on a previous floor and kind of build that skill set as a nurse in order to apply and be a part of the ICU. But some nurses like to work on another floor and get more experience and feel more comfortable, and then transfer in like I did. But as I was working full time, I did go back to school, and I got my bachelor's degree in nursing. So you could do that completely 100% online on the bachelor's portion. And that is what I did. I did my bachelor's at Ohio University, and I completed that in 6 to 7 months because I decided to be full-time in school while being full-time at work. But it was very manageable, and I personally want to go on to get my master's. I don't want to just stop at being a bedside nurse forever. So some of the masters you can get with nursing is being a nurse midwife, which means working with helping delivering babies. You can also be a nurse practitioner, and you work with under a provider, and you can prescribe some medications. And it's very similar to being a physician assistant. NPs and physician assistants are kind of almost the same. And then there's also a certified registered nurse anesthetist, which is what I want to go into get my master's in, and it's working under an anesthesiologist. It's a CRNA, and what you would be doing as a CRNA is you would be intubating patients during once they lose their airway. Intubating means putting a breathing tube down to help with and assist with breathing. You can also work in surgery rooms as a nurse anesthetist and provide anesthesia. And there's so many more things that you could do, and you can work in different settings. You can work on a labor and delivery unit as a CRNA and administer epidurals. So there's just so much you could do, and that is what I want to go into. And to apply to the CRNA program, you do have to have a minimum of working in critical care for at least a year, and the programs are super competitive to get into. In Michigan, we do have 3 or 4 schools that have CRNA programs. So hopefully I will be applying to them and continuing my education and getting on my master's, because I don't just want to stop here. And I know you guys are all still in school and going on to college soon, hopefully. But I just have to say, you guys should enjoy it, because me being out of college right now feels super weird. Like, I truly, truly miss being in school, and I feel like you guys would probably be the same. I know it sounds crazy, and you guys are probably thinking, what in the world is she saying? But you reach a point where you've been in school for 12 to 14, 15, 16 years of your life, and then you just go onto your career path, and you're not in school anymore. So it's always a great thing to continue your education, and you truly will miss it, as weird as that sounds. They say your college years are the best years of your life. And that's where you find out who you truly are and what you want to be and pursue. And I will say this too. So once you decide on what you want to be, you can start taking your prereqs for a whole year. And a year later, you decide that, oh, maybe this really isn't for me. That is okay. If you change your career path, that is okay. And a lot of people think it's a taboo that, oh, you're still in college and you don't know what you want to be. It's okay. You'll eventually find out what you will want to pursue, and there's nothing wrong with that. And a lot of people too like to put an age on school, and that if you reach a certain age, you can't go back to school, you're too old. But I highly believe that is not a mindset to have. You can be any age and do what you want to do. But yes, I would love to take some questions now. If you guys have any questions about nursing or other things about myself, or you guys as well, asking questions about certain things in college in general.
I have a question about, how do you deal with patients that you've known for a long time and then they pass away?
That's a good question. So I've actually come across this multiple times, and so a lot of people think that nurses become immune to death. That is very wrong. I could never ever become immune to a patient dying, especially when you develop a long-term relationship with them. It's heartbreaking. You almost feel like in that moment, like, did I do everything I could for that patient? Was it something I did? Was it like, what could I have done? I always reflect, like, what could I have done differently? And that's where my mindset was wrong. Where I was putting it on, so like I always put it on myself, and oh my God, like I could have done this differently, or this or this. But it's sometimes is very hard, but you learn to kind of cope with it and debrief on what you did and what you did to help them, and always being there for that patient when in the toughest and hardest time of their lives really helps with their condition. And just being there for them makes, at the end of the day, you can say like, okay, I did everything I could. Maybe this patient has been fighting for such a long time, and seeing them suffer like that sometimes is more heartbreaking than actually losing the patient because of what they're going through. So that's where I learned to kind of cope with it and deal with it. But it never gets easy.
Thank you.
Of course.
I have a question.
Yeah.
Have you ever had to deal with like a difficult position with like doctors or like other medical professionals around you?
Yes, I have multiple times. But majority of the times it's always a good outcome. Sometimes, so as a nurse, you are a very strong patient advocate, and you as a nurse also are at the patient's bedside a lot more. And there's nothing wrong with that. They come and see numerous amount of patients a day. So their job is to come and assess the patient's condition, and see what the plan of care is for today and put in some orders. So sometimes when you try to advocate for a patient, it doesn't get communicated well at times, and you can kind of butt heads with other medical professions, but it's okay because it's part of the process, and communication is a very, very big thing for me at least. If you are coming in and assessing my patient, I want to know what the plan of the care is and what we're going to be doing for the day, and why we're giving certain medications as opposed to others. So I really, really appreciate when doctors do take that time and look for me on the unit and kind of address that with me, because then it's also safer for the patient. But that's with any profession. You're always going to, sometimes you'll get along great with your coworkers, and sometimes it's a little bit harder to, but I think that's okay.
Thank you.
I have a question.
Yes.
How do you deal with patients who refuse treatment? And have you ever had patients who refuse treatment that they really needed?
Yes, we do get that a lot actually. And so patients are allowed to refuse treatment. They would have to sign a form it's a form called leaving against medical advice, which kind of tells them that they're signing a paper that states that if you leave and something happens to you, we are not held liable. But we get a lot of patients that do that, and the types of patients that we get usually are typically alcoholics that don't want to receive the care. And other types of patients are just people that haven't been even to a hospital, and when they do come into the hospital because of an emergency, we find out that they have undiagnosed conditions that we need to treat, but they just refuse the treatment. But we do come across a lot of scenarios like that, and people that come in with car accidents and they have a fractured neck, which is we need to treat. They refuse treatment typically. But they do have to be competent, which means that they have to be their mentation has to be there. They can't have any mental conditions, because if they do have any psychiatric history, for instance, they can't make their own medical decisions. So then that's when we can hold them against their will in the hospital and treat them. But if they are competent enough to make their own decisions, they can sign a release form and leave against medical advice.
Thank you.
Of course.
I had a question. You said you wanted to become a nurse practitioner, like in anesthesiology.
Mm-hmm.
Is there a difference between like for adults and children?
Yes. So with nursing, you can be a pediatric nurse, which means working with patients that are 18 and younger, and a regular nurse, you work with ages 18 and above. So you with CRNA, just like with regular nursing, you can work with the pediatric environment and basically doing what I explained earlier, like intubating patients, providing anesthesia during surgeries, but you'll be working with the pediatric population.
Yeah, thank you.
I also had a question. So Nice lecture, by the way. Thank you for the lecture. That was amazing. And
I feel like, I'm sorry guys, I felt like I was talking and I'm
no, you're good. You're good. And so I noticed in the lecture you were talking about like the characteristics of nurses. You know, like have to be like, empathetic, critical thinking, all of these things, because it's very important. You know, well, like what in specific, what kind of like mentality do you have to push you through nursing? Because obviously it's a lot of stress on the brain, because like, okay, like you have to take care of a patient. Let's say like a patient dies, you just can't like drop in the middle of your job. You still have to take care of your other patients, you know? So like what kind of mentality do you have is important, you know?
Yeah, of course. And that is a great question, actually. So I'll just kind of go through how my day is when we do have a patient code and they ended up passing away. So normally, I'm going to speak from the ICU setting. So normally, if a patient is very, very sick, you just have that one patient, and because of how critical they are. But normally, like when I go into work, I'll have 2 patients. So once my patient starts deteriorating, you kind of see it with the monitors and how their condition is, and it's very hard to process at times. But when a patient does deteriorate, you have to critically think, and you kind of almost push your feelings aside while everything's happening, and with the adrenaline you get. And then once the patient does pass, that's when it hits me like a bus, all my emotions. So it's okay to cry. Me and my coworkers, when a patient does pass, we all like get together and just kind of cry it out, let out our emotions, and that way, and then we put ourselves together for when the family members come in to see the patient before they take him down to the morgue. But it's okay to let out your feelings, and that's one of the most important things is not suppressing your emotions, because we're all human. You know, we can't just push aside something like that. So it's very normal, and sometimes it can be very stressful. So when I come home, I like to de-stress, and I personally love and enjoy reading during my time off. So I'll take a nice shower, I'll get in bed, and I'll pick up my book, and that's my way of de-stressing. A lot of people like working out, a lot of people like playing sports, so it's always important to have something to look forward to when you get home and to de-stress. And even just venting or like kind of debriefing with your coworkers about what happened really helps as well. But I hope I answered your question.
Yeah, it really did. But like I also wanna take it like a level deeper, and I wanna ask like what character trait do you have in that? I know you have to de-stress and all these things. So now what kind of character trait do you have to like to push through, you know? Like obviously perseverance is one of them, but like what do you think are important character traits to keep you up, you know, on the job?
An important character trait, I would have to say, just having that empathy and that strength to get through something. Just being a very strong person, and that isn't something that you'll have right out of nursing school. Like you have to go through certain things, and as being a nurse, like you'll kind of develop that. You'll get that strength from just seeing your patients get better, just knowing that they hopefully will overcome this, and I feel like that's very important. But definitely I would have to say strength to fight through it.
Thank you so much for answering my question. And I have to go right now, but I want to thank you so much for the lecture, and I want to thank everyone who came and like participated and everything. Yeah, I'm sorry I have to go so soon, but I'll see you later. Thank you so much. See you, everyone.
I just had a question. So for your prereq classes, for dual enrollment, what classes do you recommend taking so we can get rid of them?
Good question. So my sister, I have a younger sister, and she just started college. So I'm kind of going through it with her too, because she's wants to be a nurse as well. And I recommended her taking, so with your prereqs, you're going to have to take your science courses, of course, a math class, a couple math classes, like sociology, speech. Speech is required for basically anything you go into, and a couple like English courses. So what I would recommend taking for dual enrollment while you're still in high school is kind of the easier courses, such as speech. Speech is a very common class to take for dual enrollment. Sociology is a good class to take. What else? There's humanities is required as well, and also on the easier side, so that would be a great course to take for dual enrollment as well. But anything that you feel like you can do great in, I would recommend. And another tip for dual enrollment is it's nice to be away from high school for a bit, but you're going into college. But I would still highly recommend making sure that you try to get that A or A- or A+ in that dual enrollment class, because it will be on your transcript for when you go into college. So those are some of the classes that I personally recommend to take during dual enrollment, because they're on the easier side.
Okay, thank you.
Of course.
I have a
I got a
question.
question too.
Miss Dakroub, I have a question for you too.
Yes, of course.
When somebody's at like a critical point and it's time to break the news to the family, do you guys usually have to like lie before and then break it later, or so they don't get too emotional, or what do you guys have to do?
Okay, so that's a great question. So typically when my patient's deteriorating, or let's say they have passed already and the family is not at bedside, you do have to make a call out to the family. And I personally don't like telling them over the phone that the patient has passed away, because you have to put in your head that this person is going to be driving into the hospital. And if you tell them right then and there over the phone that their loved one has passed away, it puts them in frantic mode. So I don't want them getting injured on their way to the hospital, like getting into a car accident. So what I would say is I'll call them and inform them that there has been a change in the patient's medical condition. And if they are able to, they should come to the hospital and at the patient's bedside as soon as they can. And you kind of break it to them like that. And usually they understand. So once they come up to the unit, I'll kind of go up to them, and that is where me and the physician and the people taking care of the patient kind of break the news and let them know that there was a change in patient's condition through the night or day, and that they have passed away. And then typically they'll ask they'll sometimes be very frantic, and just lose it and break down. And then we kind of explain to them on what went on and what happened and what led them to this condition and how they passed.
Okay, thank you.
I have a question.
Miss Dakroub, what kind of AP classes or dual enrollment courses did you take when you were in high school?
AP Human Geography, even though that had nothing really to do with nursing, but any AP course, to be honest, would be great, because that will bump up your GPA and you can get into any school you would want with a higher GPA. AP English I was in, which helped me with my English prereqs, and AP Biology. But I believe those, and I don't know if Dearborn High has AP Anatomy and Physiology, or even just an anatomy and physiology class.
Yeah, they do have anatomy.
Yeah, I would highly recommend you guys take, even for any medical professional, this doesn't just have to be for nursing. Human anatomy and physiology is such a great course, and it will guide you and lead you to any medical profession, and it's a requirement for basically any medical profession as well.
Did you take any dual enrollment courses?
Yes, I took one, but it was a speech class.
What made you decide to go into the medical field?
So when I was in high school, actually, I had my mindset on wanting to be a lawyer. And then I came to realize one day that I'm not really a great speaker, I would say, or I didn't really like writing papers. I hated writing papers. Even for college, I hated it. But that's when I realized, like, okay, maybe law isn't what I want to do or what I want to go into. So I was very open to the idea of something medical. And at the time, I wanted to work in surgeries. So I was looked into what can I do that doesn't require me to be in school forever, because I eventually want to have a family and raise my kids, and something that's very flexible. So nursing popped up, and I did my research, and the schedule was perfect because as a nurse you only work 3 days a week, and you work 12-hour shifts. So you typically have 4 days off. You can always work overtime and work more, but a full-time position is considered only 3 days a week, which is great. So at the time when I wanted to do surgery, there's a position called a scrub nurse, which she assists the surgeon with handing the surgeon the instruments and assisting with surgeries and doing patient care while a patient is under anesthesia. But then I realized that I can't handle surgeries and seeing people being cut open, so that really wasn't the route for me. But there's endless opportunities with nursing and things you can go into. If you get bored of your job, you can go and find another position. You can work help delivering babies. That's labor and delivery. You can work with babies. Being a pediatric nurse, I have to say, I personally think those are the toughest kinds of nurses, because I can't handle the anxiety and the stress of taking care of such a little baby. So you definitely have to have a strong mindset for being a pediatric nurse, or pediatric anything medical, really. And yeah.
Have you ever had any doubts, like now, of choosing this field of work, or?
Yeah, of course. You always come across doubts, and you always kind of look back and say, okay, is this something that I want to do forever, or do I got into the ICU. When I first started my position in the ICU, I was doubting myself a lot because it was so new to me, and having these intensive and really, really sick patients, I was always questioning myself, like, am I capable enough to handle all this and handle the patient care that comes with being an ICU nurse? Because I would look at my coworkers and they knew what they were doing all the time and all that, but that you develop as you grow with a nurse. Like, you, even if comparing is a very wrong thing to do too as well. So I can't compare myself to a nurse that's been in the ICU for over 20 years, because that's 20 years of knowledge that I don't have. So that was a thing that I had to look back and be like, okay, I'm going to do my best. I'm going to do what I can do. And you have to have it in your mind that you are going into this and wanting to learn new things. And that was a big thing for me. But even being a nurse that's worked for over 30 years, you will always learn something new every day.
Would you ever go contingent, like I know you work 3 days a week, but would you ever consider contingent when you like start a family, or like start schooling again?
Oh yeah, so contingent thing has been on my mind. Like, when I do have kids and stuff, I personally don't want to put them in daycare, so a contingent position would be very ideal. So with being a contingent nurse, usually some hospitals only require you to work 3 days of the month. So as long as it's basically working once a week almost. And being a contingent nurse, you could still work full time. So the way it is you kind of make your own schedule, like, for the week. And if you want to work 3 or 4 days of the week, you could still do that being contingent. But it gives you that option to kind of you're only required to work only one shift a week or 3 shifts a month. So yes, that is something I have considered, of course.
I have a question. Did you have anybody to like guide you through nursing school, or like were you on your own?
So with nursing school, I didn't know anyone in my family, but in nursing school, you develop friendships with a lot of people, and I had a group of 3 or 4 people that we basically cried together and went through everything together in nursing school. So we had that bond that pushed us through, and we reached our end goal together. So, and now they're forever friends. I still talk to them almost daily or even weekly. And yeah, definitely you need to have that group of people, at least of a couple or 3 people that are going through what you're going through, and having study groups is great. So I definitely think that's a very important part of nursing.
I have a question. So, speaking time-wise, like you said, like you would want to start a family and, you know, so how would like how long would it take you to become like um a CRNA with, like you said, you need experience to go into the CRNA program. So how long do you think it would take you?
That's a great question. So you typically need, in order to apply to the CRNA program, at least 1 year of experience in critical care nursing. So I've already surpassed that, and I have my 1 year of critical care experience. You do have to do some shadowing. You have to follow other CRNAs around and get some letters of recommendations, and take your CCRN exam, which is my next step, which is an exam that is a certification in critical care. So that's an exam that I have to study for at least a month or 2 months before I can take it. So once I have all those lined up, I can then apply to CRNA school. So CRNA school now, it used to be a master's degree, but now they are changing that and making it a doctorate. So it used to be a 2-year program, but now because it's going to be a doctorate degree, it's going to be a 3-year program. And they're making that change in 2021 to 2022, where there's no more masters in CRNA. It's just going to be a DNP, like a doctorate in nursing practice, to become a CRNA. So that would mean that it's going to be 3 years of schooling. So right now I'm 25, and if I apply right now, it would take me, I would graduate at 28 years old. But the application process, if I get accepted today, I wouldn't start the CRNA program till a year from now. It's like a whole year that you would have to wait. It's a very competitive program, but that shouldn't ever steer you away. If anything, that should keep you motivated and get that drive to become the CRNA. So all in all together, it would take at least like 3 years, 3.5 years.
Not counting like your undergrad, right?
No. So undergrad, like to complete your prereqs, I would say 2 years. And then a nursing program, whether it's going to be an associate's degree or a bachelor's, it typically takes anywhere from 2 to 4 years. So an associate's degree, you can graduate and be a registered nurse in 2 years. And then your bachelor's degree, if you decide to go into that program right away, it would take anywhere 3 to 4 years. So in order to get your bachelor's altogether with your prereqs, it would take about 4 years, 4 years or 5 years. And then counting the 3 years of CRNA school, that's 8 years in total of schooling, college.
Okay, thank you.
Do you guys have any other questions?
Yeah, I have one more quick one.
Yeah, of course.
What was like the hardest experience you ever went through, throughout like job wise, like at the ICU?
So there is one that it was probably the craziest thing I've ever experienced. It was a patient that came in. He was stabbed multiple times. and they had to take him in for an emergent surgery, and they had to open up his stomach because the stab wounds affected his liver and his a bunch of organs. So they had to take him for surgery, and when he came back from surgery, they kind of left his stomach open because of everything was so swollen. So that's a normal thing that they do, is they'll leave his stomach open, his abdomen, and then he was very young too. And then throughout my shift, he started deteriorating. He wasn't doing so good, and he ended up losing a pulse. And we had to do some CPR. And when you do CPR, you're pounding on their chest. So mind you, he had the open belly. So when you're doing CPR, we had blankets over him so there wasn't blood going everywhere. So when we were doing CPR, we weren't able to revive him and bring him back to life. So after we finished, when we wanted to like get him all cleaned up and ready for his family members to come in, we pulled back the blanket and his intestines were all over the bed. His intestines came out of his stomach. So I have to say that was the craziest thing I've ever seen. But it's an image I'll never forget. But
Yeah, tell her.
Hi, Rasha.
Hi.
That's Ola. It's Ola.
Oh. Yeah, that's one of the nursing friends that I was talking about that we cried together and went through everything together.
Love you.
My ride or die.
I love you, Rasha.
Love you too.
If you could like take your degree and like never stop, like let's say schooling, I know this never happened, but schooling was free and like you can do as many classes as you wanted. Where would you stop with your degree? Like would you stop at your PhD? If you got your PhD, how many PhDs would you get? Like stuff like that.
Like I said, I probably would be in school till I'm 90 years old if I could. People think I'm crazy when I say that, but definitely I wouldn't want to stop with getting my CRNA degree. I would definitely want to go on to get my PhD. And it depends at how many kids I have and eventually grandkids, but I would love to get my PhD one day, inshallah.
So earlier you said about the stab victim and how they left his stomach open.
Yeah.
So if they left his stomach open, did they like wrap him, I guess?
Yes. So typically when they leave your abdomen open after surgery, they put in something called a wound vac. So it's like a big sponge that goes in your stomach and it kind of sucks everything together, and it's your stomach is still open, but it's definitely wrapped and bandaged. But with the pound of pounding and stuff you do, your patient has coded and lost the pulse. With all the pressure, that's what led to the intestines coming out.
Oh,
But yeah,
okay, thank you.
they're definitely wrapped. It almost looks like saran wrap, like that clear plastic wrap, in order for the infection to occur.
With a
Okay, thank
patient
you.
like that, oh sorry, with a patient
How
like
did you
that,
deal with? It's okay. You can go.
it's okay.
Okay, so how did you deal with looking at blood and like surgery? Because I get really grossed
She's
out.
asking.
Was it how do you deal with looking at blood? So in the beginning, I would get very queasy and nauseous, especially when I saw my first surgery. That was not a great experience. So I had gone into the surgery on an empty stomach, which was the number one mistake that I could have done from the start. And once they cut open the belly, that's when I was like, ooh, I need to sit down because I'm about to pass out. And I got super yellow. But that's when they gave me some crackers and orange juice to drink, and they told me that's the number one mistake you just made, is not having something to eat before coming into the surgery. So I learned my lesson from then on, and I always like to go into work and have a little bite of something to eat. And also with time, you kind of will get used to the blood. And as a nurse, you're going to be giving injections, drawing some blood, and then you're going to also be changing some wound dressings. You can have patients with like diabetic ulcers on their feet, so you'll be doing some dressing changes. So you kind of develop a stomach over time, as weird as that sounds. But the more you're exposed to it, the more you kind of get used to it. But even if you are afraid of blood, a lot of people think like, oh, that's why I'm not going to the medical field because I can't handle the sight of blood. But it's okay if you're like that because you start to develop almost an immunity to it, if that makes any sense.
Yeah, it does. My internet's really bad, but thank you.
Of course.
Going back to that patient, with people who are like open like that, they're gonna have a high chance of getting infections. Would there be a limit with visitors and like how you like what's contracting in and out and making sure that your materials are properly sanitized and stuff like that?
Yes, that's a very great question. So typically, because he was an open belly, we do limit, already in the ICU, it's limited on the amount of visitors. So typically, pre-pandemic, we would only have 1 to 2 visitors a day, but you can rotate in and out. And you would definitely have to have, you make them wash their hands and sanitize before they go in the room. And normally they won't touch the patient or anything, but everything that like when we're doing any dressing changes, majority of the time it's sterile. So that's a great question, and we do clean and sanitize everything that we use, and majority of the products that we use too are new, so it's only patient like for that patient. And then we would just toss it out. But for equipment that we use, we bleach them so that they're sanitized.
I have a question.
Yeah.
It's kind of specific. When you're performing CPR on a patient and you're pressing on their sternum, what do you do if there's damage to their lungs and that's why they're at the hospital?
So majority of the time that you do compressions and CPR, you definitely break ribs. So when you're pressing on that chest, you don't even have to apply a lot of pressure because it's crazy. You feel the ribs breaking, and that's what can puncture your lung. So that's how their breathing gets, like their lungs get damaged when their ribs poke their lungs. But that, in order to fix a poked lung, a ruptured lung, is inserting, for say, a chest tube. And that would like drain any air that's pushing on the lung or blood that's around the lung or in the lung. So that definitely does happen. And usually we have a nurse doing compressions, and then a respiratory therapist or another nurse providing bagging air into the patient's mouth. So you typically do 30 compressions and 2 breaths, and that's the cycle. So before becoming a nurse, even for anything you go into, I think even if it's not anything medically related, I do believe that people should be BLS certified, which means just providing basic life support. Even if you're a teacher, I think teachers do have to provide, have the certification of being BLS certified. So I think it's a very important certification, even if you work at the grocery store, because there are times where if you're a cashier, for say, and a patient drops to the floor and is unconscious, you should always have that clinical mindset to know how to provide basic life support. So I definitely, that's a very important certification to have.
I have one last question. I'm sorry.
No, don't apologize.
So during school, what helped you, like what studying tips do you have?
Group studying really helped because you kind of bounce off ideas off of the group you're studying with. It always varies person to person. So in nursing school, I had the iPad Pro with the pen, and I would kind of decorate my notes, and that was more appealing to my eyes, and it made me enjoy studying more instead of looking at just a blank sheet of paper with just words all over. I personally don't like doing that. I color coded everything. A planner is the key to everything because it kind of keeps everything organized. And then if you're studying like pharmacology, which is a bunch of medications that you need to know, I liked using flashcards or making flashcards on Quizlet, and just making like tests and quizzing myself through that. But any terms that I have to memorize, I always liked making flashcards or just making a Quizlet test. That was very helpful for me. And then usually I like to read, when we're assigned chapters to read, I like to read the chapter once through, and then I'll go back and just kind of skim through it again and highlight like the important parts. But that's the way that I found helpful for me. But you develop certain studying habits as you go through college. You'll try different and multiple ways, and then you'll stick with what works best for you. Like some people I know used to record lectures off of their phone and then they would go back and listen to it, but that's because they're more of an auditory learner. I'm more visual. I like looking at PowerPoint. I like looking through the book. I like organizing my notes a certain way, but every person develops different studying habits. But that's also why I like group studying, because you kind of get a little bit of everything.
Okay, thank you.
I'm sorry, but I wanted to ask, what type of doctors, like specialists, have you worked with in the ICU?
So I've worked with possibly every specialty, even on regular, normal medical surgical floors. You will work with almost every specialty. You work with infectious disease doctors, cardiothoracic surgeons, cardiologists. You work with doctors that have to deal with the GIs, like gastroenterologists, ophthalmologists, ENT doctors. There's a bunch more that I'm trying to think of. General surgeons, intensivists, which are the critical care doctors, regular internal medicine doctors like the family practice. I've worked with those. Even PMR, which is pulmonary medicine and rehab. A lot of patients need those, especially after a traumatic brain injury. But those are the ones that I can think of at the top of my head. But being a healthcare professional, in any field you go into, you definitely collaborate with a ton of other healthcare professionals.
So I have a question. So is there a floor for like different specialties? So like, let's say there's a floor for neuro or like cardio, is there
Yes.
like a different, okay.
Yes, so you'll have the way Beaumont and Dearborn is set up. I'll kind of run through the floors and what each floor is. So the first floor is like the main lobby area. You have the basement, which is the ER. So that's where everyone comes in, and then they send off to other floors. The second floor is just like a short stay unit. It's like an observation unit. You could stay there for less than 24 hours, and then you'd get admitted if you needed to. The third floor is where our ICU is located, and our step-down ICU, where step-down ICU is where you're not critical enough to be in the ICU, but you're still critical enough to require more than just a medical floor. And then the fourth floor is our cardiac floor. All the patients typically are on heart monitors on that floor. And then the fifth floor is a orthopedic floor. So when you have patients that have hip surgeries or knee surgeries, after surgery, they'll go to that floor. And they do a lot of physical therapy on that floor as well. And then the sixth floor is like a surgical floor. When you have like a minor procedure and you require inpatient admission, that's where you would go. The 7th floor is like a general medical floor, same as the 8th and 9th floor. They're general medical, but the 9th floor also has more of the elderly population. So you have people with dementia up there. That's the old floor I used to work with. You have like the older population, and then the 10th floor is the oncology unit. And then that's where all like the cancer patients go, or if you have a patient that is hospice, which means end of life care, they typically are on the 10th floor as well. And then you have another tower that's more mother baby, labor and delivery, and that also is where our NICU is located, the neonatal intensive care unit, which is the little newborns that require intensive care. That's in our separate tower as well. So yeah, you definitely, and then you definitely have a floor for almost every body system, if that makes sense. Like there's your neural floor, your cardiac floor.
Do you have to do like more school for different floors, like not different floors, but like different types, like neuro or cardio? Are you just able to do more like hours?
No, so whenever you graduate as a nurse and you get your license, you can apply to any position. You do not have to go to and get more schooling if you want to do pediatric versus like normal adult nursing, or if you can go into the ER and be a nurse, or ICU as soon as you graduate and get your license. But some ERs and ICU do require you to have prior experience before applying, but some you can get accepted into right away. But even with labor and delivery, if you want to be a nurse and help deliver babies and be there for the mom, that also doesn't, no nursing specialty really requires any extra schooling or hours. But it does help when you want to apply for your first nursing job to have maybe some medical experience, whether you work at a outpatient clinic or being a nurse assistant or even being a nurse extern. Those really help on your resume. I personally have I've done an internship at a medical office, but that was really the only experience I had. While I was in nursing school, I used to babysit. Because it was the perfect job to have while being in nursing school because of how time-consuming nursing school was. But I was just giving you an example that you don't have to do those, but it really definitely helps if you do have those on your resume.
Okay, thank you.
I know like every 2 or 3, I don't know the exact year, but you have to like, so you don't lose your license, you have to do like 20, I think it's called IUs, or I'm not sure what name of it is called. I know it changes every year. Is it different for all nurses, or is it the same for all nurses?
No, so actually that's funny that you mentioned that because my nursing license expires next week and I had to do my CEUs. So that's actually a good reminder to renew it. But no, it's every 2 years. You just have to do at least 24 credit hours of continuing education, basically. So you can do it on pain management. There's more research that's done and evidence-based practice through with nursing and just anything medical in general. The care is always changing and new medical procedures and medications. So you definitely have to keep up with the research and get your credit hours and CEUs. There's a website that actually you can keep up with and get your CEUs from. And pain management is the number one thing. The one I just currently did was human trafficking as well, which is a big thing in Michigan, in Grand Rapids. And just a bunch of other CEUs and continuing education classes and courses.
Thank you, because my mom's a nurse and she just did it, so I was wondering if it's different or if it's the same.
Yeah, it's the same.
what would you say was the hardest part of like being a nurse overall?
The hardest part for me is when a patient does pass away, and having the family members come in. That for me, I still struggle with, because having to tell their loved one that the patient has passed and seeing them break down, that's when I start to get very emotionally like distraught, and I cry with them too sometimes, even, and that's a big thing for me. That's hard to deal with really, but that I have to say is the hardest part of nursing is losing your patient.
Thank you.
So with nursing school or like just any medical profession, like with it being very time consuming being in school, like and like if you and money is like a problem for you, so you have to make money while going to school, like what professions do you recommend to like do? Like phlebotomy, I think that's how you say it, or something.
Yeah, so are you asking like what job is good to have while being in nursing school?
Yeah.
Yeah, so you can have any job, but I do recommend um, definitely having a job that isn't so time consuming after work, if that makes sense, or maybe even working. You can definitely work full time and still be in nursing school, because I've had colleagues that had a whole family, like 5 kids, and they were in their 30s or 40s, and they were still like going through nursing school, and they were able to maintain it while having a full-time job. So not only did they have a whole family, they were also the provide like bread maker for the family, and they had a full-time job while doing nursing. So it all depends on you and how you're able to handle like such high amounts of stress dealing with work and school, but it's very doable.
I have a quick question. Uh, when you're a nurse, do you guys ever have any like call-ins at like for an emergency that you have, or is it like a set schedule?
Yeah, yeah, of course. You can definitely call into work. Are you asking like say if I wasn't feeling so well and I want to call in for tomorrow?
No, I mean like if there's an emergency at the hospital and they call you in
Oh,
specifically.
no. So there are certain types of nursing where, yeah, they're on call, but majority of the time, if you just apply for regular positions, they typically won't, unless they're very short staffed. They can text you and be like, hey, do you want to come into work? We're very short. We need some help, and it's up to you. You can say no though. But yes, there are types of nurses that are typically on call. Um, so yeah, you can have those positions, but you don't have to apply to them. You can have just regular set schedule, 3 days a week type job.
Thank you.
This is probably a weird question, but do you ever get drop-offs for like gifts for kids in the pediatric units where you like go around passing out cards or gifts somebody brought to the kids?
Yeah, that they do that, and they have volunteer services too, where they'll make blankets for patients, and they'll go around giving them to the patients. But yeah, we do have a lot of that. Some people will even donate a lot of toys to the hospitals. Like at Children's, they'll have like a box that they'll pass out to the kids.
Are kids allowed to drop off boxes now that we're in COVID, or are there restrictions on
I,
that?
I think there are restrictions on that. I highly doubt they're doing it now, because things have changed everywhere, not even just in the hospitals with COVID. But I believe if they do drop off, then they would have to sanitize them or wait a certain period before giving them to the kids.
If no one has any more questions, this will be like the time where we wrap it up. Everyone, please stay a little longer because I would like to explain everything. But Mrs. Dakroub, thank you so much for coming and giving us this lecture. We really appreciate it.
Of course, thank you guys so much for having me. And I can drop my email if I figure out how to use the chat. And if you guys have any other questions or and even if you just want to just some guidance, you guys can definitely send me an email, and then we can go from there. I'll just type my email.
Thank you.
Of course. You guys
Thank you
can
so much.
Thank you.
Bye, guys.
Bye. Thank you so much.
Goodbye.
Bye. Thank you.
Enjoy your day.
Bye. Good luck.